Hello everyone. In the previous section, I have discussed about the site determination of the clavicle, and in this section, I will discuss the general feature of the clavicle bone. It is the only long bone that lies horizontally. It is subcutaneous throughout and is the first bone to start ossifying. It is the only long bone which ossifies into the membrane, and it is the only long bone which has two primary centers of ossification, and there is no medullary cavity. Now, the features of the clavicle bone. First is the shaft. It is divisible into the medial 2/3 and the lateral 1/3. Now, the medial 2/3, it is rounded and has four surfaces: superior surface, the inferior superior surface, the anterior surface, the posterior surface, and the inferior surface. Now the anterior surface, it is convex forward, and the posterior surface is smooth. The superior surface rough in its medial part, and the inferior surface has the rough impression at its medial end. The inferior surface has the rough impression in its medial end. Now the lateral half. The lateral half has a longitudinal groove. The lateral half has the longitudinal groove. See the groove. The lateral half has a longitudinal groove. Now lateral 1/3 of the shaft, it is flattened. It is flattened from above downward. The lateral 1/3 of the shaft, it is flattened from above downward. There are two borders in the lateral 1/3, the anterior border and the posterior border. Anterior border, it is concave forward. Posterior border, it is convex. It is convex backward. The anterior border, it is concave. The posterior border, it is convex backward. The superior surface, it is subcutaneous, and the inferior surface present elevation called conoid tubercle and trapezoid ridge, and a ridge called trapezoid ridge. This is the conoid tubercle. This is the conoid tubercle and the trapezoid ridge. Trapezoid ridge. Conoid tubercle and the trapezoid ridge. Now, the lateral end. It is also called the acromial end. The lateral end, also called acromial end, it is flattened from above downward, and it bears a facets that articulates with the acromial process of the scapula bone. This is the acromial process of the scapula bone, and it articulates with the acromial process of the scapula bone to form acromioclavicular joint. Now the medial end. The medial end, also called the sternal end, it is quadrangular and articulates with the clavicular notch of the sternum to form a sternoclavicular joint. First is the acromioclavicular joint, and second is the sternoclavicular joint. The articular surface extends to inferior aspect. Four articulates with the first costal cartilage. Now in the next section, I will discuss about the attachment through the clavicle. Thank you.